I'm Nirav Shah, Director of the Maine CDC. I'm joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to be with you today to talk about all things COVID-19 for the entire state of Maine for today, Wednesday, June 9th, 2021. And we begin today's updates on a sad note. Maine CDC is reporting 3 additional COVID-related deaths today. One was a resident of Kennebec County, another a resident of Saginaw County, and the third a resident of York County. One was a woman and 2 were men. One was in their 60s, another in their 70s, and the third in their 80s. Their deaths mean that 843 people in Maine have died with COVID-19. We'd like to take a moment to offer our deepest condolences to their family members, friends, and communities during this time of grief. Overall, across the state, there are a total of 68,384 cases of COVID-19. That represents an increase of 53 cases since yesterday. Cumulatively, 2,043 people have been hospitalized with COVID-19 since the beginning of the pandemic. And right now in Maine, 56 people are in the hospital with COVID. 27 of them are in the critical care unit, and 14 of them are on a ventilator. In terms of our testing metrics, our 7-day PCR test positivity rate stands at 1.58% as of yesterday. I'll report out today's positivity rate in just a bit, but as of yesterday, our 7-day PCR positivity rate stood at 1.58%. And in terms of vaccines and vaccinations, as of this morning, 54.25% of the entire population of Maine has been fully vaccinated for COVID-19. And looking at just those who are eligible, that is to say those who are 12 and over, 61.6% of the eligible population in Maine have gotten the shots that they need. Speaking of vaccines and vaccinations, I wanted to take a moment to remind folks that our mobile vaccination unit is going to be in Portland this Thursday through Sunday from June 10th through June 13th. It will be situated in the parking lot of Rising Tide Brewing and will be offering the Johnson & Johnson vaccine from 11 a.m. till 7 p.m. every day, Thursday, Friday, Saturday, and Sunday. These vaccines are available at no charge to you, and no appointment is needed. Although, if you'd like to make an appointment, you are welcome to do so. The best way to make an appointment is to call 888-445-4111. But again, no appointment is needed, and there is no charge to you for these vaccines. If you haven't been vaccinated yet, and you've been looking for a chance, an opportunity to get the Johnson & Johnson vaccine, the 1-dose, one-and-done shot, and coming to Portland this weekend is available to you, the mobile vaccination unit will be at the parking lot of Rising Tide Brewing from Thursday through Sunday, offering the J&J vaccine from 11 a.m. till 7 p.m. I'm going to try to stop by tomorrow afternoon, as well as try to spend a chunk of Saturday there. So I'll be there. If you happen to stop by, say hello. I'll be the guy with the big dog with me. So with that, I'm going to turn things over to our colleagues in the media. And the first question for the afternoon goes to Pat Callahan.
Thank you, Dr. Shah. Good afternoon to you and Commissioner Lambrew. I'm wondering, it seems as though over the last couple of weeks that first dose vaccination numbers have plateaued. Is that your impression? And if so, what does it tell you?
Yeah, thanks, Pat. Yes, that is what we've seen in the data as well. When we take a look on a daily basis of the ratio of first doses administered to second doses administered, what we've seen is that shortly after the authorization of the J&J vaccine for youth and adolescents, for those 12 to 15, we saw a big jump in first doses. But more recently, we've started to see more and more second doses as that population has started to be eligible for their second dose of the Pfizer vaccine. But one note there, Pat, that I think is important is just to zero in on the J&J vaccine for a moment, because the J&J vaccine is counted in our numbers and other states' numbers as a second dose. So if someone were out there getting the J&J shot, they wouldn't show up at all in our first doses. They would be automatically tallied in our second dose number. So that's just a consideration that you've got to keep in mind, especially as our mobile vaccination unit has been down east, up in Madawaska, and then now swinging down to Portland, and then Old Orchard Beach. The J&J vaccine that it administers will go on to that second dose tally. And that's just a consideration you've got to keep in mind when you're looking at those first versus seconds.
Also, can you update us on the number of people who have died with COVID after being fully vaccinated, and what you think the public should take from those numbers?
Sure. Thanks, Pat. As of yesterday, there have been 8 individuals who have passed away with COVID after being fully vaccinated. I want to make a couple of notes about that, Pat. The first is a reminder: when the Maine CDC reports deaths, we report individuals who have died with COVID. These 8 individuals, their passings are sorrowful, and we mourn their loss. However, in these situations, many of those 8 individuals had other health circumstances that may have also contributed to their passing. That's an important thing to note. Just because you may have other chronic medical conditions, we still want you to get vaccinated. And that was the situation for many of these individuals. The other, though, Pat, is to keep context in mind. Although 8 may sound like a lot, and it's certainly, again, something that we mourn the passing of, taking a look at how deaths have changed before the era of COVID vaccine and after the era of COVID vaccine leaves no doubt that the implementation of COVID vaccination has led to a dramatic and sustained reduction in deaths associated with COVID. There has been a tendency nationally to take a look at those who have died after being fully vaccinated and potentially give the impression that the vaccines are not as good as they could be. I do not want that impression to stand at all. These vaccines are spectacularly effective and have exceeded almost everyone's predictions about what a vaccine could give. Sadly, some individuals have died. Many of those individuals had other health circumstances, but that doesn't take away from the effectiveness of these vaccines one iota.
And finally, a question for Commissioner Lambrew, if I could. Commissioner, I presume you and the governor are consulting on when to let the state of emergency expire. Can you tell us at all about either when that may happen or what conditions you would need to see before you would recommend that?
Sure. And while we do know that our trends here in Maine have improved, certainly since our peak in April and that other big surge in the winter, we still have, as Director Shah just noted, people dying with COVID-19. We have people in the hospital with COVID-19, and we continue to see it spread in different parts of the state. We're opening outbreaks on an ongoing basis, so we still have a challenge in making sure that people are protected against the disease. You know, when we do make these recommendations, we always look at the qualitative as well as the quantitative data to see what's going on and what we know. We don't have any announcements at this time, but we are beginning to do that kind of planning. So, for example, the Department of Education is working on its plans for the fall, because we do anticipate, with progress towards vaccination and the types of protocols that we've learned about, like pool testing for children in schools, we do expect that all schools in Maine, as a Department of Education, will be communicating. We'll be bringing kids back for 5 days full-time in-person learning this fall. We think we can relax the physical distancing guidance with these types of advances, but that's one example of the types of changes that we make based on evidence, based on the information we have, to adapt as we try to recover from this pandemic.
Thank you, Commissioner.
Thanks, Pat. Over to Emily at the Sun Journal next.
Hi, good afternoon, Dr. Shah. I'm wondering if there's any areas in the state in terms of new cases or sustained number of cases that are of concern for you. I know we spoke about in April, Androscoggin County and Central and Western Maine was a big hotspot, and I'm wondering if that has changed or you're not really concerned about any place in particular.
Well, Emily, we remain concerned anywhere there are cases. Thankfully, the uptick in cases that you and I have talked about in and around the Androscoggin County area, that has muted, and we're not seeing that sustained increase that we were 3, 4, 5 weeks ago. That's a very good sign. And that decline has been paralleled in other counties where, even though there may have been slight upticks, not long ago, we were somewhat concerned about Piscataquis County. Subsequent to that, a somewhat smaller uptick in Penobscot. We've not seen those divergences where one county was out in front of the others in terms of new cases lately. That's a very good sign. And again, in part driven by widespread vaccination rates. I'll say two things. The first is we've still got more to go on the vaccination rates even though as a state, we are doing spectacularly well. I couldn't be prouder of the fact that Maine continues to lead the league tables in terms of the percentage of our population that's vaccinated. We should recognize here within the state that those vaccination rates are uneven from county to county. And as a state, we are, generally speaking, only as safe as our least vaccinated county. So we've got more work to do to make sure that every county in Maine can get its vaccination rates up and prevent those surges from happening. The second thing is we are not relaxing our look at those data. We take a look at these county level data to make sure that if we see something happening, we're getting an eye on it, investigating whether there might be other things that need to happen, increasing testing, increasing availability of vaccines. We're not slowing down on it.
I'm also wondering, and maybe this is a question for Commissioner Lambrew, what the uptake of the pop-up vaccination clinics have been like, and along with that, if there's any other ways that the state is considering or new tactics to get those last people who just still haven't gotten their vaccine.
Yep, we will continue to work to the very end of this pandemic on trying to get people who are interested in getting a vaccine a shot. We've had about 40 different organizations apply through our pop-up clinic application. For people listening, it is available for any organization that thinks it can round up at least 10 people to get a dose. We're matching those applications with interested vaccinators who often can go on site to be able to deliver shots. And it's been a variety of organizations, from camps who are expecting campers this summer and new employees coming from different places to houses of worship that continue to be partners on the front lines to get some of our hard to reach population. So we will continue that effort. We also are looking hard at what works in other states in terms of incentives. We were happy that our Shot to Get Outdoor did get some Maine people their first shot as they got a fishing license, for example, or a gift card, but we're looking at what else might work. So we'll be hopefully announcing some more ideas to try to encourage people to get vaccinated in the coming days.
Thanks, Emily. Over to Brian Sullivan next.
Dr. Shah, I wonder if and this maybe is for Commissioner Lambrew, any updates on the guidance for summer camps that are, I'm sure, fast approaching?
Yep, so recently we did make a shift from using our own Maine developed COVID-19 prevention checklist to US CDC guidance. And we know that the US CDC recently did update its guidance for camps. That guidance is thorough and clear and has lots of information for our summer camps, both the day camps and the overnight camps. And we encourage all people who work at those camps or run those camps to look at that US CDC guidance.
Okay, are there any benchmarks in terms of school in the fall that could be reached that would allow the state to recommend or allow local schools to decide that unmasked learning for students and teachers would be allowed?
Sure. So I'm going to just begin with, again, what the Department of Education is working on with Governor Mills that will be announced shortly, which is about the public health protocols that have posed challenges to schools bringing students in for in-person learning. What we've learned throughout the school year is that not all schools, but some struggled with some of those physical distancing guidelines for example, trying to say that children should be 3 feet apart when sitting at desks, or they should be 6 feet apart when they're sitting in a cafeteria eating. What we're doing is, for the summer, with this pooled testing program, doing what we already announced previously, which is saying if a summer program is participating in pooled testing, they can relax all those physical distancing guidance, because that extra layer of protection coming with pooled testing should mitigate the increased risk. And for the fall, we do anticipate, with advances in vaccination as well as pooled testing, we really can move to eliminating all of those physical distancing requirements for the fall, which will be critical, I think, for schools, for their planning purposes, to bringing children back 5 days a week for in-person learning when that's the right thing for those students. All that said, we currently do have a requirement for masks to be worn in childcare settings, in schools, and that's because right now, even those 12 to 15-year-olds that are getting their vaccines, they're not yet fully vaccinated, and there's not yet a vaccine authorized for children under the age of 12. So at this time, we still have that requirement that in those two settings, childcare and schools, where the majority of people at this point are not fully vaccinated, people wear masks.
So in the fall, 3 months from now, pool testing coupled with vaccination rates for maybe older students, it is a possibility that it could be like it was if certain circumstances are there, like a big classroom, for instance.
We are certainly working on, again, what are those parts of our public health guidance that have limited the number of people in classrooms or in schools, and we believe that we're addressing that today.
Okay.
Thanks a lot, Brian. Over to Blair at WGME.
Hi, Dr. Shah. You did touch on this earlier, but this week we talked with the family of a man who died from COVID-19 despite being fully vaccinated. And as I'm sure you can imagine, many people are concerned that they could catch the virus and die after being fully vaccinated. What is the risk here?
Blair, thank you for raising this. And again, every single person who passes of COVID-19 or not is a loss for all of us. And our condolences go out to the family of the individual who's passed away here. Thankfully, though, at a population level, and my message to Maine people is that overall, the risk of passing away with COVID because of COVID after you've been vaccinated goes down very significantly. In fact, just a couple of days ago, yesterday, in fact, I think the US CDC put out some recent data on just how remarkably effective the vaccines are, particularly among older folks. Although there is a possibility that someone may still pass away with COVID after being fully vaccinated, the question is whether it's better to be vaccinated or better not to be vaccinated. And every single piece of data that we've seen thus far with all three of the COVID vaccines demonstrates with no equivocation that one of the best ways, the best way to reduce your likelihood of death or hospitalization with severe disease because of COVID is to be vaccinated. It's still sad that individuals may pass away after getting fully vaccinated. Here in Maine, as you noted, we've had 8 such individuals. But were it not for the vaccines, as a state, those numbers would be much higher.
And I just want to briefly touch on restrictions in Maine and how they're lifting, and many people are now going maskless. I mean, was it too soon to lift those restrictions, given the risk that people can still catch the virus and die from it?
Well, I'll start, but the commissioner and I have discussed this topic, both the substance of it as well as the timing piece that you note. And Blair, I think my view is that the changes that we made, that the US CDC initiated and that Maine reflected, came at the right time. Case rates were starting to decline. We had started to see decreases in our positivity rates, as well as the number of new daily cases. Thankfully, we had already started to see a lengthening in the time period between deaths when those were happening in Maine. All of that is in recognition of the fact that the virus levels were starting to decrease, in part because of widespread vaccination rates. That is what enabled Maine to make those changes in ways that if we had been in another state, there may have been more concern. It's important to note at the same time, though, Blair, for those who are unvaccinated, wearing a mask is still a good idea because they could potentially, unbeknownst to them, transmit the virus to somebody else who's themselves not vaccinated. In addition, if you happen to be going to a place, a store, a location that requires you to wear a mask, regardless of your vaccination status, that still applies.
Okay, thank you.
Let me turn now to Patty White at Maine Public.
Thank you, Dr. Shah and Commissioner Lambrew. Following up on Emily's question about the pop-up clinics that organizations can apply for, where generally are the applications coming from? Is it broadly distributed across the state, or are you seeing demand higher in certain areas?
I can start, Commissioner, if you, or, yep. Patty, we've seen demand across the state. Many, for example, it's been actually a quite diverse group that's put in requests for these pop-up clinics, which we've been able to honor. Some have been houses of worship. We've had a couple of workplaces. We've had summer camps who want to make sure that, for example, counselors, staff, et cetera, are fully vaccinated. So we've seen a diversity. I looked at the list back about 2 days ago. I didn't really see a clear geographic trend or anything of that nature.
Okay, great. And are applications still coming in? Is demand still, I guess, high for this program?
They're still coming in. Here's what I'll say, Patty. If you or your group, whether it's an employer, a house of worship, a social group, a sports team, if you'd like to take advantage of this, we've got vaccine and we've got vaccinators. So we'd like to ramp those numbers up as much as we can.
Okay, great. And then I was also curious to know what's happening with the Strengthen Me hotline. What's the call volume like at this point, and what kinds of issues are people calling about?
Sure. So we can get you those data. I don't have them off the top of my head. We do know we have a great need continued for supporting people given the different types of anxiety and basically post-traumatic stress that many people face during a pandemic and during the recovery. So, as we transition from the phase of the pandemic where we had pretty clear, steady rules to changing rules, we know that there's a lot of anxiety that people face with those types of changes. We have been concerned about what we've been hearing about concerns about drug overdoses and other signs of substance use disorder. That partly is seasonal. We see that most years with the start of summer, but it's a particularly big concern as we're trying to make sure that our health system is ready to deal with it. And we are trying to make sure people know where to get help. We have a website for strengthenme.gov that has resources for different types of people, be it a healthcare worker who is struggling with caring for people during the pandemic to people on the front lines in different areas. We have different programs for different types of people to make sure that we really have addressed the different range of needs. We just know sometimes it's darkest before the dawn, and we need to continue our support and our work to make sure that people know that if you need counseling, if you need some help with substances, we're here for you.
Okay, thank you.
Thanks, Patty. Over to Amy Brown next.
Thank you, Dr. Shah and Commissioner Lambrew. I think I have a question for each of you. First, with Dr. Shah, with the people who died after being fully vaccinated, do you have any information about how they were exposed?
I don't have those. I mean, we have done our typical case investigations as we would with any individual who tests positive, particularly for a breakthrough case. There wasn't one predominating factor that we saw or anything of that nature. They were exposed as so many others are from people in their communities, et cetera.
Okay, and other than the fact that many of them had other medical conditions, have any other commonalities such as age or anything like that been discovered among them?
You put your finger on it, Amy. They tended to skew toward an older age range as well.
Okay, thank you. And Commissioner Lambrew, the section of the vaccine dashboard that breaks down the percentage of people vaccinated by zip code hasn't been updated since June 1st. Is that going to be updated soon, and will it be kept regularly updated?
Yeah, I think that we update that weekly, Director Shah, is that right?
We do,
Uh,
Amy, and yeah, an update should be forthcoming soon. We've been thinking about the data, so yep, Amy,
Actually, bi-weekly, now that I think about it. We do that
Yeah.
bi-weekly, but we will be doing that. And as a reminder, this is a tool that we encourage people who are interested in helping get people vaccinated that they use, because it shows red zip codes are for two reasons. Number one is because the rate's relatively low, less than 60% of people in that zip code are vaccinated. And number two, there's more than 2,000 unvaccinated people in those zip codes, which means bringing a clinic there, doing extra work there to raise awareness is a good way to get to people who might need help.
Thank
Amy,
you.
I was just going through my memory banks as well. Yep, it's probably not slated to be updated until into the middle of the month.
Oh, okay.
Yeah,
All right.
I'm pretty sure we say right on the website that the data will be updated every 2 weeks.
Okay, I didn't see that if it's there. Thank you.
Yep. Thanks, Amy. Over to Patrick Whittle next.
Thank you very much. Wanted to double check a couple things. Earlier, we were talking about the emergency order, and Commissioner Lambrew mentioned that it's still in effect. Could you repeat what is the plan regarding the order going forward? It sounded like you were talking about how it could be reevaluated at some point soon.
Every month, we look at where we are with the pandemic to calibrate and adjust our guidance. And that is based on both qualitative information, what do we know about outbreaks, transmission, the spread of the disease, as well as our vaccination information, and quantitative metrics. So as I mentioned earlier, just today, the Department of Education announced, because of progress that we're seeing, that there will be changes for the summer, meaning that a summer program, summer school, other programs affiliated with schools that are participating in pooled testing can relax the physical distancing guidance that previously were requirements. And Department of Education also announced that given this mitigation and progress that we're making in the fall, the physical distancing requirements will be repealed. So that's one example of how we take information and look at all the different guidances out there and adjust as needed.
That's it. And that takes place on a month-by-month basis?
Probably
Right.
more often weekly.
Right.
We talk every single week probably, but I think we do, as we said previously, recognize that the incubation period for COVID-19 is a 2-week period. So we do try to make sure that we have information, that's solid information, as we make these changes. And it's notable that we are 2 weeks past, for example, the changes that Governor Mills made on May 24th with the repeal of the generalized mask requirement and our capacity limits, for example.
Right. Regarding the plan to resume full-time in-person learning in the fall, we just received the statement about this moments ago. Are individual school districts still going to be able to scale that back if they desire to, or to take a different approach? Is this, I guess what I'm asking is this guidance or is it a directive?
So I do refer detailed questions over to the Department of Education, but I can speak to the fact that Governor Mills, Commissioner Macon, myself, Director Shah, we all recognize that we put in those distancing requirements for the previous school year as a means of protecting staff, teachers, and students against a deadly disease, one that we didn't know a lot about when we went into the school year last year. We know a whole lot more about the disease. We're seeing progress in vaccination across Maine residents and hopefully Maine youth. And we know that having policies like a pool testing program in place can really help quickly identify people with COVID-19, isolate them, and keep schools safe. So with that progress and new information, we felt comfortable saying it's time. The recommendations and requirements that had previously been a barrier to some schools having kids in school 5 days a week, full time, that can go away. There may be circumstances where remote education is preferable, and that's something that I think the Department of Education will be working with school districts on. But we at this point think that the statewide requirements for physical distancing are no longer needed.
I see. Circumstances such as like when it's 120 degrees in June.
Yeah, and I will note that there's not a lot of evidence that wearing a mask is the reason why you need to close down a school when it's hot. When it's hot, there may be a need to close down schools, and we are hopeful actually that one side effect of the pandemic is there has been significant hundreds of millions of dollars coming to Maine schools from Congress, from these laws that have passed, some of which we know is going towards improving ventilation, installing HVAC, and really making sure that the climate control in schools is good, which is a dual benefit. It both benefits schools from protecting against diseases like COVID-19, and it benefits kids on a hot day like we've had.
Right. Okay, great. Thank you very much.
Thanks, Patrick. Over to Eric Russell next.
Good afternoon, Dr. Shah and Commissioner Lambrew. I had a question about community transmission. Early on in the pandemic, we talked a lot about outbreaks and then worried about when community transmission might hit. Does it work the same backwards? Are we going to reach a point soon, and are we reaching that point soon in some areas where community transmission really isn't happening and new cases are outbreak driven?
Well, that's wow. Okay, thanks for that question, Eric. We're not there yet, but that is essentially that is effectively when folks throw around terms like herd immunity, or the term I prefer, population level immunity. That's really what they are referring to, but with different words. When we achieve whatever that threshold is, and you've heard, you and I have talked about how there's not a single number, but it may be in the range of 70 to 80%. What starts happening from an epidemiological perspective there is that at a community level, even those who have not yet been vaccinated can enjoy the protections of those that have been vaccinated. Effectively, the vaccinated can confer immunity to the unvaccinated because the virus has nowhere to run. That doesn't mean that COVID goes away. There will still be COVID, even if we get to that magical number, whatever it is. And the way that COVID will occur in those settings will largely be through pockets of unvaccinated people, probably precipitating an outbreak. That could be where folks are more vulnerable, like long-term care, where they are huddled together, like perhaps in a shelter for those experiencing homelessness. You get the idea. But yes, that's the epidemiological other side of the coin to the reverse of community transmission.
Just a quick follow-up on that point. Does that make, contact tracing a little more valuable than it had been I mean, it's always been valuable, but you really weren't able to do it in an effective way when there were hundreds and hundreds of cases every day. It wasn't practical. But now where cases are much smaller and more limited, does contact tracing become that much more important?
Yeah, yes, indeed. Actually, Eric, just last week, I met with our epidemiology team to think about now that case numbers are going down, somewhat paradoxically, but it's in line with your question, we want to ramp up the intensity of our case investigations and contact tracing because, as you know, they're going to be a slightly more outbreak driven than they will be community transmission driven. We're not there yet. We haven't gotten to that threshold, but let's hope we do, and we'll get there gradually. And so we want to be ready to act upon these outbreaks and try to spot clusters of transmission sooner rather than later. That necessitates more intense case investigation. So, yep, you're exactly right.
Okay. The last question I had, I'm sorry, go ahead.
No, I'd be remiss if I didn't say, hey, everyone, let's get there. Let's get your shot. But, that's at this point, that's a hanger on.
I want to shift briefly to hospitalizations. We've seen a pretty dramatic drop in hospitalizations, which I think everybody agrees is really good news. But there have been pockets of hospitalizations in other states and even in some other countries where we're seeing a lot of younger people ending up in the hospital, which makes sense. More and more older people are vaccinated and they're less likely to be hospitalized. But are we seeing any of that? Are there any recent trends in hospitalizations that might suggest, younger people or anything like that, or not really anything new than what you've already reported out?
Yes and no. So yes, we have seen that trend in the last, I'll say 2 months or so, and it's not anything new since that time. But to recap it, what we've seen as a state, as well as what health systems have reported, is that hospitalizations have started to come down. That's a good thing. Just 2 weeks ago, we were at about 117 people who are in the hospital for COVID. Now that number, as I noted a moment ago, has thankfully come down. We're at 56 now. So that's a remarkable decline. We hope it'll continue in that direction. Geographically, it's been across the state. That's also a good thing. It's also been met by reductions in critical care and ventilator use, all good things. So it leads to the question of who is being hospitalized. Right now in Maine, what we are seeing is the folks who are being hospitalized tend to skew younger. They tend to hail from more rural parts of the area, and they tend to be unvaccinated. I'm hoping to have some more numbers tomorrow on that vaccinated piece, but that's what we've seen in big picture terms. More rural, skewing younger, largely unvaccinated.
Thank you both.
Last piece there, Eric, because it's been communicated to me by hospital officials at 2 hospitals. The other piece is that even though they're younger, generally speaking, younger folks are not hospitalized at the same rate as older folks are. But when folks are vaccinated and they're younger, they're ill. They're quite sick. The severity of illness of younger people when they're hospitalized is it's quite concerning.
Thank you.
Thanks. Over to Megan at WMTW next.
Thanks for taking my question. So what I'm gathering, I'm sort of sifting through a release from the Department of Education and the Mills administration, but it sounds like to me, getting rid of the masks in schools really hinges on the vaccination of all school-aged kids. It really, I guess that would be the jumping off point. And with Pfizer announcing that it's expanding its trials to 5 to 11-year-olds, I think that was just yesterday. Is the state working proactively to figure out how it's going to kind of launch its vaccination for kids? I apologize if this question's already been asked. I think maybe Pat Callahan asked a similar question, but I guess the idea is that are kids going to be going to their pediatrician for this? Are you going to be doing outreach? Is it going to be things in schools? What's the plan? Do you have a plan?
So maybe I'll let Director Shah answer that second part of the question about vaccinations going back to school. And just to clarify, today's guidance from the Department of Education was about it changing the school public health guidance to limit the need for physical distancing in schools when they're participating in pool testing for the summer, and eliminating all those physical distancing requirements for the fall. We currently do have a requirement that masks be worn in schools because at this moment in time, we don't have anybody under the age of 16 who is fully vaccinated. That will change, and we'll update the guidance as evidence change, as information changes, but that policy on masking is not yet changed. Well,
I'm sorry. I just want to interject that, yes, I understand that that's something that's down the road, but I guess what my question is there conversations about that happening down the road and how it will be deployed?
You know, I think what we've seen is that when our policy changes, we will tell you, you'll be the first to know, but our policy has not yet changed. So we will let you know when it does. Thanks.
Megan, on the latter part of your question about vaccinating younger kids between the ages of 2 and 11. One note there is that based on what I've been briefed on by federal colleagues, any authorization for that younger age category is not thought to come before, some folks have speculated, and it's all speculation because FDA makes the final call, but some folks have thought, later in the fall, maybe around Thanksgiving. So that would be after the school year has already begun. And that's the timeline that folks are looking at. Could it be sooner? Hopefully. Might it be later? That's a possibility. In terms of how and where that younger group would be vaccinated, at that point in the vaccination phase, many of the larger scale sites might be offline. Some already are. So we'd be looking to work with pediatricians, pharmacies, some of the mainstays that we are moving toward now as one of the better ways to vaccinate that younger category. Many of those kids may be up for their normal childhood immunizations anyways, and building COVID onto that will be part of it.
Am I drawing too many conclusions by saying getting rid of masks hinges on vaccination of all school-age students?
I think, I don't know that there is a direct line between those. It's not that that's
Okay.
correct or incorrect. It's just not so much a direct line.
Thank you.
And the final question for the afternoon goes to Jessica Piper from the BDN.
Thank you, Dr. Shah. At risk of possibly belaboring this issue too much, I was wondering if you could have an update on the number of breakthrough cases, not deaths. And I was wondering if you could say anything about how those cases were detected, how many were, symptomatic versus maybe just picked up through surveillance testing or something like that.
Sure thing, Jessica. The current number of breakthrough cases in Maine is 387. I have to do my obligatory. What that means is that 99.95% of those who have been vaccinated in Maine have not gotten COVID. So we are talking about 0.05% of the population that has been affected by a breakthrough case. Nationally, that number is 0.07%. In Maine, it's 0.05%. So that is the exceedingly small piece of the pie that we are talking about relative to everyone else who's been vaccinated. That being said, we want to track those things because it's good science and good epidemiology to do so. I'll get you the exact breakdown of symptomatic versus asymptomatic. We do track those things, but to answer the question you raised, Jessica, how do we find out about these? Well, we find out about them in the same way we would with non-vaccinated COVID cases. Some small fraction of breakthrough cases do in fact have symptoms. It is lower than the average, but they have symptoms. They go and get tested as one should if they've got symptoms. And lo and behold, they've got COVID. Our case investigators reach out to them as they normally would for any positive case. We find out that they're vaccinated and we do a deeper dive. When did you get vaccinated? That sort of thing. But we also find out about some of these cases because some of those who are vaccinated are still participating in various types of testing, maybe at their workplace, maybe because of another club they happen to be a part of, something of that nature. And if they turn positive, we follow that same protocol. So we find out about them in largely the same ways. But if we do find out about them and we learn that they've been vaccinated, then we do that deeper dive to try to get a sample from their positive test so we can sequence it, things like that.
And have there been any outbreak investigations at nursing homes or assisted living facilities, places like that have turned up like a large number of vaccinated people who have tested positive?
There was one, maybe about 3 months ago, maybe, at a long-term care facility where that was a hypothesis, because we did see early on, we saw a fair number of cases among individuals that were vaccinated. When we ended up doing a more global analysis of the entire facility after universal testing, we found that the rate was a little bit higher, but not beyond what might be expected through statistical chance. So it wasn't one that raised any particular flags. We nevertheless sequenced as many of the samples as we could to determine whether perhaps that was driven by a variant. It turns out it wasn't. It was being driven by the normal virus that's been circulating in Maine. So we haven't seen anything of that sort in Maine. However, Jessica, counterparts of mine from 2 other states, Kentucky and Connecticut, maybe, I'm sure on the Kentucky one, they have published in the CDC's journal, they have published write-ups of outbreaks that in nursing homes that were largely affecting the vaccinated populations. You can certainly find those, or we can send them to you. So it has happened, but it's been a rarity.
Thanks. And then on an entirely different subject, are there any plans to kind of extend accessibility for vaccines for kids in the 12 to 15 age group with school out? Are there kind of other ways that the state is trying to target those vaccinations specifically?
Yes, we're trying to make sure that access is not the reason why a 12 to 15-year-old 12 to 19-year-olds, anybody 12 to a 90-year-old doesn't get vaccinated. Given the constraints around the use of Pfizer, one of the things that we've started to do is urge vaccination sites to see if they can offer more than one vaccine. So for example, the large-scale vaccination site operated in partnership with the York County Emergency Management Association down in Sanford. They are actually offering 3 vaccines. They're offering Pfizer, Johnson & Johnson, and Moderna. And the reason they're offering Pfizer is in part to make sure that anyone who walks in the door, no matter their age, is eligible to get a shot. So we're going to continue things like that to make the Pfizer vaccine as available as possible. Thanks, Jessica. Commissioner, that was the last question for the afternoon. Anything from you before we close?
Sure. I would like to go back to talk a little bit more about the Strengthen Me program. This is a program run by our Office of Behavioral Health that provides people with stress management, coping, and resilience skills specific to COVID-19, the pandemic, and what it's meant for people's lives. To date, as of May, we provided about 41,389 unique encounters, meaning talk to people on different occasions, either providing crisis counseling services, helping people through group counseling or public education sessions, as well as providing educational material and other sort of supportive contexts so people know that they're not alone. You can find information on this program at strengthenme.com or by calling 207-221-8198. People are available to talk every day from 8 a.m. to 8 p.m. And it's just one source of support that we have for people in Maine who are struggling with the challenges of day-to-day living during this pandemic and this recovery. So we urge people who need help to reach out. Thank you.
Thank you very much, Commissioner. And thanks to everyone for taking some time out of their afternoon to join us. Thanks to our colleagues in the media for the great questions today. We hope everyone has a good day. We look forward to chatting with everyone again soon. In the meantime, please be kind and take care of one another. Talk to everyone later.